Hello friends. So there are some questions which our club foot parents commonly ask. Question number 1, club foot is only on one side. Why are you putting the shoe on both the sides? So remember, controlling a single foot is very difficult. So we have to have a both the side shoe with a connected bar to have good control on the affected side. And it's not going to hamper the growth or the problem on the normal side. So don't be under the impression that it's going to stop the growth or something. The second question, there are many braces, Dr. Saab, which one to use? So yes, there are many braces in the market, but any brace, all the braces are based on the same principle. Some braces may provide extra movement to the ankle joint, and the correction and what they are meant to do, they do the same job. So any brace which is affordable, which is comfortable for the child and well fitting, it is fine. So it doesn't matter which company brace you buy, but get it checked with your treating doctor. Third question, I could not brace the child yesterday, is it okay? So this may become a persistent issue. Not bracing for one day, then it may become suddenly 2 days, then a week. So don't fall into the trap. Use it religiously, and then if you are not able to use for one day, you compensate it on another day. So like 4 hours you have put less, put 4 hours more on the next day. Other question is, what are the holes near the base of the shoe meant for? Yes, so those holes are not for air to flow. It's an extra advantage, but the holes are meant to actually for you to see whether the heel is touching the sole of the foot. So there should be no gap between the heel and the foot, which indicates a ill-fitting brace or you have not put it properly. Another question, can I use the shoe without a rod attachment between them? No. The shoe without a rod is not even half as effective as a shoe with a bar rod in between. Despite good correction after the plasters, why do you still need a brace? So we know this from Professor Ponseti that even when you get good correction, don't use a shoe. They are going to recur almost 80% of the times without a brace. So the purpose of the shoe is to maintain the correction and prevent recurrence. It's not to correct also. Okay, so once the corrected foot is there, you have achieved a good correction. The braces are there to maintain the position. Another parent have asked, my baby had 5 casts, is the tenotomy compulsory? Yes, so the question is whether the child is able to get enough dorsiflexion. That means, is the child able to get enough ankle upward movement? Anytime it is less than 15 degrees, it is not acceptable, and tenotomy is necessary, because that's when you get the complete correction. Then next question is, we had good correction, sir. We used the braces as achieved or advised till 4 years, but the doctor has suggested a tendon transfer surgery. Why? So despite a good brace use, about 10 to 15% of the children may have something which we call as dynamic supination, where the foot goes in slightly inward motion. It's seen only during walking. When the child is sleeping or sitting, you don't see it. And those children may benefit with tendon transfer. It will help prevent further recurrences. Ideally, it is done at around 3.5-4 years, whenever that bone, lateral cuneiform bone, is ossified. So our last question is, our baby had plasters but no tenotomy. Can we just use braces? So if the ankle correction is good, you are getting good upward movement of 15 degrees, and that can be maintained in braces. If your child doesn't have movement, good sufficient movement, sometimes in the periphery they just do the casting and put them in braces, then it's an incomplete correction. So remember, the braces are not meant to correct, actually maintain the correction. So already a corrected foot can be maintained in a brace, but they don't help in correction. So that's an important point.